Hey, welcome to the Healthful Woman Podcast, the fastest growing podcast in women's health. Today's Monday, October 21st, 2024. In honor of October being Breast Cancer Awareness Month, we are redropping a two-part podcast today on breast cancer in pregnancy, which was originally dropped as a high-risk birth story in 2021. My guest is Jamie, which is not her real name, who is one of my favorite humans. Great story. All right, few reminders. The Unexpected, the book I wrote with Emily Astor, is available wherever you buy books. So, my many. Second, please continue to email us questions you have for our mailbag podcast. To send them in, email us at hw@healthfulwoman.com or go to our website and click on the link that says, appropriately, send us your questions. Please remember these questions are for a mailbag podcast, not your own personal medical advice. For that, ask your doctor. All right, thanks for listening. See y'all next week.
Welcome to today's episode of Healthful Woman, a podcast designed to explore topics in women's health at all stages of life. I'm your host, Dr. Nathan Fox, an OBGYN and maternal fetal medicine specialist practicing in New York City. At Healthful Woman, I speak with leaders in the field to help you learn more about women's health, pregnancy, and wellness. All right, Jamie, welcome to the High Risk Birth Story podcast. Thank you so much for coming in.
Thank you.
We've known each other a while now, and obviously I know the story of your birth, and you know the story of your birth, but it's such an amazing in many different ways, the word amazing story. And I'm just really appreciative that you were willing to come and talk about it.
Thank you. It's cathartic for me.
I do believe that. I think for the podcast, that's been my experience, that women coming to talk about their own stories is cathartic. Everyone has a story, right? And some of the stories are somewhat straightforward, and some of the stories are very complicated with a good ending, and some are very complicated with a bad ending, unfortunately. But I've just found that women don't have that outlet to tell the story in completion. People just want to know, you had a baby, the baby fine, everything's good, have a good day. And that's it. But it's important. And there's so much to learn. I mean, for listening to these stories, they're so unbelievable and so impressive and so impactful.
Yeah, I look forward to sharing.
So, Jamie, we're talking about the birth of your daughter almost 3 years ago. We're coming
Correct.
up on her 3-year-old birthday.
That's right.
Amazing. And
Unbelievable.
Yeah, and I'm feeling old as all these years pass. And
you look the same.
Thank you.
Frozen in time.
My body's not frozen in time. I have aged terribly. Just tell us, where were you coming into pregnancy? You know, sort of where you were in life and what was going on.
So I actually was pretty much a newlywed. I was 33 years old. My husband and I got pregnant very, very quickly. We were very fortunate. And I had a pretty standard normal pregnancy, I would say up until around 6 months. I was at a regular OB, not a high-risk clinic. And they started noticing I was having some issues with my blood pressure, riding a little bit high. There was some thought that maybe I did have chronic hypertension, which meant I was a person who had blood pressure that ran higher pre-pregnancy. It's still open for debate. There were issues controlling my blood pressure. It was running on the higher side. So from like about 6 to 7, up to my 6th month of pregnancy to the 7th month, we were dealing with trying to manage my blood pressure and control it. And obviously from the OB standpoint, you can probably talk more about it, the concern with the hypertension.
Right.
The blood pressure is preeclampsia or eclampsia, which is a very unhealthy situation for mother and baby. So they were watching me closely. At some point when I got closer to my 7th month of pregnancy, my husband and I we felt like maybe we weren't getting as close attention as I could have been getting as far as my blood pressure was concerned. I had a couple of visits to labor and delivery for high blood pressures, and we felt like maybe after having a consultation with the high-risk clinic that maybe the high-risk team might be a better team to manage what I had going on.
Right. At the time, and just for disclosure, you and your husband are both physicians.
Correct. Young physicians.
What did I say?
Young
physicians.
Yeah,
okay.
Not like senior,
Understood. Okay.
We don't wield a big stick or a lot of power.
You wield a stick that's big enough. Was that part of it? Meaning that you sort of felt, well, I'm a doctor and I know about preeclampsia. Was it led by that or just not even related to that?
As you'll see the story unfold, I think flipping the switch from being the doctor to being the patient is a very difficult flip to switch. Yeah. Especially in something that's very vulnerable, like pregnancy or cancer, as we'll get to that.
Right.
And so for me, I think there was a lot of, I wasn't really sitting in the doctor's office as a patient.
It's tough. It's you're a patient, you're a colleague.
Right.
It's you know more, which is sometimes good, sometimes not good.
Sometimes not good.
Okay. And other than the issues with your blood pressure, did you have any specific concerns in pregnancy that you entered with, or was it just sort of, like, hey, we're pregnant, this is great, this is exciting?
I really didn't have any specific concerns. My health in general
Uh-huh.
was okay. Didn't have any history of any major medical issues, aside from maybe mild asthma, which wasn't
Right.
active at all during my pregnancy.
Right.
I didn't have any problem conceiving. Everything had gone well, and we didn't have any major red flags. So we felt confident and happy. We really had no idea what was coming down the pipeline.
And so ultimately, you did transfer your care formally to the higher ed practice, to our practice,
Correct.
which is happy to say
Yes.
we then got to
The
have
best
you.
practice.
Thank you. Why would you whisper that so
I know.
loud? No, so you came aboard. What was that like? Was it a relief, or was it a little scary that, like, you got to
Absolute
sort of, like,
relief.
you got, like, bumped up to the next level?
Absolute relief.
Relief.
For
Okay.
me and my husband, it was absolute relief. We had met a lot of the team here already because
Right.
during the course of my issue with my blood pressure, they had been sending me for consultations with the high-risk doctors. And so we had met a lot of them. And so I felt very confident that I was going to get the absolute best care.
So you come over to us, and again, that was, as I recall, sort of the beginning of the third trimester,
Correct.
6, 7 months,
Yeah.
28 weeks. And you come over to our practice, and we're ready to have you, and we know you, and we're all excited. And tell us what happened.
So actually, it was an interim period between the time that I was being transferred from the previous practice to the high-risk clinic. It was about a week and a half.
Right.
Where I was just sort of chilling at home. And, I mentioned I have asthma. So I'm kind of a little bit of like an allergic person. I have also a history of eczema. Throughout my pregnancy, I sort of had like the pregnancy itch. I was getting flare-ups of my eczema. And so my eczema actually was centered around like my torso. So I had very dry skin on my arms, on my chest, on my breast, my whole upper body. And I would scratch all night. And in that week period between the time I was let go by my previous OB team and moved here, my husband was like, "This is ridiculous. Your skin looks like crap. You have scabs everywhere. You're itching like crazy. Like, come on, you know better. Like,
Right.
you need to moisturize. Like, do something. Put something on your skin." And so I started really making a point of like trying to moisturize after the shower, morning and night. And it was then when I was really taking time with my skin along my breast area that I felt something that was different. And I would literally sit with my husband every night, and I said, feel this like one spot. It's the two of us sitting on the bed, a tiny spot. I would say less than half an inch by half an inch on my left breast, on the outer area. I was covered in, eczema, which is basically like a very rough excoriated rash.
Right.
We're both sitting there thinking, putting on our, doctor hats. Is this like an inflammatory Like, it was a small little firm area. Nothing was distinct. It didn't feel like a pea. It didn't feel like a ball. It was just an area of the skin that literally, if you pressed on this table right here, it just felt a little hard.
Right.
Just felt different. My husband said, "Oh, it's nothing. Don't worry about it." And every night I would sit and I would touch it. Every night in that week period.
Did he really think it was nothing? Don't worry about it. Or was he saying that just so you wouldn't worry until you saw somebody else?
So it was a week period
Right.
where literally we were convening every evening and touching it. And
Right.
he would say, "I think it's nothing, but," he said, "You know what? We're going to see the new doctors anyway this coming week." I don't remember if it was Monday or whatever.
Right.
Let's bring it up. And I was a person, like at that point, I was already coming with my lists to every appointment of all my questions, and especially with a new practice, going over different things. Especially I knew my situation already with my high blood pressure, that there were going to be some changes probably as to when I would deliver and stuff like that. So I had my list, and the last thing I put on my list to discuss was, mention this, spot on my breast.
Last on the list.
Last on the list.
Yeah.
And almost forgotten, by the way.
After all of the critical
Right.
things like, what hair dye can I use?
Right,
And
exactly.
can I have a Diet
Exactly.
Coke? All those important things.
Exactly. Those important things. But I mean, our first visit was with Dr. Romero,
Right.
Julie Romero,
Yeah.
who was great. And she actually ended up delivering me in the end. And, she was telling me about my blood pressure and how, I learned some things there that I may had not been anticipating, that I may not go to full term, that we may consider inducing me early. I still would probably be able to have a natural delivery, but they might not let me go all the way because of the risks of preeclampsia.
Right.
So I think I was a little bit distracted, and we were all like, "Done. Thank you so much." Gonna get out of our chairs. And the last little thing on my list, I said, "Oh, wait, Dr. Romero, wait." I said, "This last thing, I'm so sorry to like take your time. I just have this spot on my breast. I don't know, I just felt it. I have a lot of rashes and eczema. I don't know if you mind checking it out. So of course, we'll check it out. My husband and I and her went to the examining room and she examined it. And her and I and my husband all sat there and we all looked at each other and we all said, it's probably nothing, but let's err on the safe side and let's get an ultrasound. So for some of the listeners, and maybe you can maybe touch on it more, for different types of breasts and different ages, you do different types of imaging.
Right.
Ultrasound is often like the first stop for younger women.
Right.
Me personally, I happened to have at that time very large breasts that were also very dense. So
Yeah.
ultrasound was like my first stop.
Yeah. And also people sometimes get concerned about mammograms because of the radiation and pregnancy,
right.
although you can do them. Clearly you can do
Yes.
that, but some people do that. And also there's certainly more uncomfortable to undergo a mammogram. And often if the ultrasound, someone in your age group at the time, if they find it's a cyst, right, just filled with fluid, no one's going to think it's a concern. Maybe they'll put a needle in it and
Right.
sort of aspirate the cyst, but that's ultrasound. That's easy.
Right.
And so typically people will start with ultrasound,
Right.
but usually we actually leave it to the radiologist. They
Yeah.
frequently, they know what they're doing. Did you know Julie before
I did
this
not.
pregnancy?
No,
right.
I'd
So
never
did
met
you know her
her.
before that meeting?
No.
So the first time you're meeting, you're doing
Correct.
everything, and
Yeah.
then
I
you're
met
all,
a handful of the doctors
Right,
in the
but not
practice
her.
before, but not Julie. She said, let's get you scheduled. We'll do it. Of course, we're going to check it out. But it's, she
Yeah.
was very reassuring, which
Yeah.
of course, like who would think, like why? I have
Yeah.
no family history of breast cancer. I have no family history of ovarian cancer or anything that could even
Yeah.
raise an alarm that somebody my age should have such a problem. And so, all right, something in me was weighing very heavy on me. I had a little bit of trouble getting an appointment. I had about 2 weeks till the ultrasound appointment, and I was extremely anxious. Obviously, I was pregnant, all of those things.
Did you feel the mass changing over
No,
those 2 weeks?
I did not.
Right.
No.
That would
And-
have been even more scary.
Yeah,
Obviously.
no, I didn't. And the truth of the matter is that when you talk to other people and in retrospect, these things don't grow quickly.
Right.
It's not something that appeared overnight. And so in the 2 weeks is kind of like a drop in the bucket, really, in the scheme.
Medically, but not emotionally.
Not emotionally,
Right.
for sure, but medically.
Yeah.
So no, I don't feel any kind of way about it, except
Right.
it was just anxiety
Sure.
inducing. So I was calling every day to see if they had a cancellation, and they didn't. And then we showed up on the day for the appointment, and you go in, and it's a very small room, and this is pre-COVID,
Yeah.
but you actually can't take your spouse in the room because the room is very small. So they have the spouse wait outside. It's not only a cancer imaging place, it's for all kinds of things.
Sure.
So they don't automatically assume that you're going to need
Right.
some type of support.
And didn't the doctor who you're supposed to see, didn't that person book out?
Yes. So I had Google imaged the doctor who was supposed to be doing my ultrasound. I don't even remember his name to this
Right.
day, but as my husband and I were sitting in the waiting room, we saw him getting his bag and his umbrella and going to the elevator. And I said to my husband, what is going on here? I said, I need this done today. I don't care what happens. I will drag him out of his car. Like, he needs to come do this today. So ultimately, when they called me and they said he had a medical family emergency, and I had a different doctor. It's actually first the tech does the ultrasound,
Right.
and then they call the doctor in. I have a medical background. I'm watching the screen as they're doing the ultrasound. I could immediately see that there was an irregularity there. I'm not a radiologist,
Right.
but for my untrained eye,
Mm-hmm.
semi-trained eye, I could see that there was a different in the
Right. And you could see they're taking 46 pictures
Right.
of 1 centimeter space versus
right.
2 pictures of
So
everything
here
else.
I am, like I'm alone. I'm pregnant. I'm basically over 7 months pregnant at this point, sitting on this bed alone in this tiny room with this tech. And she says, I'm going to get the doctor.
Right.
It's like, okay,
Because
so
the text, they can't tell you what they
Right,
think. Because
you know.
you don't want them to say anything wrong in
Yeah.
either direction.
I don't blame them.
Yeah, you don't want
Trust
them to
me.
say it's fine when it's
I
not, or
don't.
say it's not fine when it is,
Yeah.
because that's a disaster. We have the
I
same
don't blame
issue
them.
with
Yeah.
pregnancy, with babies. It's just
I actually feel
yeah,
bad for them.
it's very hard
Yeah,
for them.
It's very hard.
Yeah.
So the doctor came in, lovely lady. She actually got my husband. So he came into the room. We're all like huddled in this tiny room,
Yeah.
the 4 of us,
Yeah.
me, the tech, my husband, and the doctor. And she said, it really looks suspicious. It doesn't look good. I said, you think it's cancer? And she said, I can't say for sure, but it looks very suspicious for cancer. And I just sat on that bed and I just was bawling. I was crying. I said, so like, what do I do? I don't even know where to start. What do I do? She goes, well, you need to get a biopsy done. We can't get you in here. This was a Friday. We can't get you until Monday. I just begged her. I said, please, I'm begging you. I'm begging
Right.
you. Please do it today.
Right.
Please, please, please. I'm begging her, not knowing what she could do. And she walked out and she came in and she sort of gave me a smile and like a wink. And she said, oh, we just had a cancellation.
Right.
I'm going to do it for you right now. A lot of humanity.
Yeah.
It's a lot. It was a lot. And
she did what she could under the circumstances. And those 3 days, it's a big deal.
Yeah.
It's a big deal.
By having the biopsy done on Friday, I was actually able to get the results on Monday.
Who called you with the results?
So actually, she had told me to anticipate a phone call from her, but it was getting close to 4:00 on Monday and I hadn't heard. So my husband and I, it's just me and him. We haven't had the baby yet. So I'm pregnant. We're sitting, we're looking at each other going, is this a good sign or a bad sign? Like, meaning if she hasn't called, does this mean everything's good? Or, so it was 4:00 and, imagining that the clinic closes at 5 or 5:30, I decided just to call. So I actually called her and she's like, oh, I was meaning to call you. Do you have a minute to talk? I said, of course.
You bet I do. I just called you.
And she said it was positive for cancer. You can't necessarily say the stage at that time, but you can say what the pathology is.
Right.
So meaning early stage could be like DCIS.
Right.
And then invasive, which is more of the cancer side, is invasive ductal carcinoma.
Right.
So that's what I had.
Right. Because the stage is more how far it's spread.
Right.
And you can't know that from a biopsy.
Right.
The biopsy tells you like the cancer we're looking at. How gruesome is it? Sort of, there's different levels of how bad of a cancer.
So the biopsy can tell you basically
the grade.
The grade. It can tell you the hormone status.
Right.
Or HER2 status.
Right.
But it can't tell you anything about your lymph nodes. It can't tell you anything about distant issues in your body, God forbid. So, she said, this is, the diagnosis and I'm really sorry. And as soon as possible, I said, well, who's my first stop? Who do I see? Like, am I talking to an oncologist? Am I talking to a surgeon? Like, your first stop is a breast surgeon. That's your first stop. So she gave me some names. So we got off the phone. In all honesty, my husband and I, we sat there and we cried. For a very decent period of time. And actually, now that I'm remembering, the doctor who did my biopsy, she actually reached out to a couple of the surgeons. So she actually took that job off my plate so that I could really have some time to absorb. Right. So she's told me to hang tight for her email to see who was going to be able to see me the soonest.
Right. Over the weekend between the biopsy and the results, were you assuming it was going to be cancer, or were you assuming not, or were you already reading up on it and trying to learn about it? Were you like, I'm just going to
definitely
mark it out and find out?
I definitely felt a pit in my stomach that something was wrong. I felt that.
Right.
I felt that my intuition, and I don't know. I just felt that something was off. So that's how I got my diagnosis. So we sat and we really cried for, you get all the feelings. Right. Why is this happening to us? What did we do wrong? It doesn't make sense. Could there be a mistake? And then, obviously calling my parents and telling them, which was a whole other level of...
Your poor parents.
I mean, it was devastating.
I can't imagine.
It was devastating.
I mean, listen, I can't imagine happening it to yourself, but also happening to your child.
It was absolutely devastating. I mean, I got the diagnosis on Monday. My parents they don't live in New York.
Right.
My mom was already with me by Wednesday for my appointment with the breast surgeon. It was very difficult. I would say I didn't sleep. I wasn't eating. Just a lot of fear. A lot of fear of the unknown.
Right.
I didn't know what this meant for me. Was I going to survive? Was my baby going to survive?
Right. Did you have a sense at all of what it meant in terms of pregnancy? I mean, obviously you had an idea conceptually, right? Just as doctors, breast cancer is probably surgery and maybe chemo, maybe radiation, depends, sort of, you understand the brackets of what's going on here. But pregnancy is like a whole, vacuum to most doctors. Are like, what the hell happens in pregnancy?
Right.
So did that even enter your mind at first, or was it?
It did enter my mind. It did enter my mind, and I'm very much the type of person that if somebody gives me a problem or a diagnosis, not only for myself, even in my practice with my own patients, like I'm very much about reading and learning and going into as much detail as I can to, try and understand. And I felt like for my own situation, the only way to really not get out of it necessarily, but the best way to handle it was to educate myself the most. And so in that brief period of time before I saw the breast surgeon, I already understood that, in breast cancer, if you're diagnosed while pregnant, there's like 3 stations and those 3 stations, first, second, and third trimester, that really determine what your treatment is going to look like. And so because I was on that cusp between second and third, I had a feeling that there was a chance that I might get chemo while I'm pregnant. That fact, by the time I went to my appointment, I sort of was thinking...
It was on the table.
I was thinking, is that what's happening? Not like, am I getting chemo, but like, am I going to have chemo while I'm pregnant? And what is that going to do to my baby?
Yeah.
Scary stuff.
It is scary stuff. And again, when someone's reaching towards the end of pregnancy, you're sort of making the decision, is it better to wait, deliver the baby, and do everything afterwards? Or is it better to start beforehand? And if you start beforehand, are you just doing surgery when you're pregnant? Are you doing surgery plus chemo when you're pregnant? And sort of figuring that out. And there's no one answer, obviously, because it depends on exactly how far pregnant, what's with your pregnancy, what's with the baby, what's with the cancer, all these things and have to be discussed. And I know that there was a lot of talk about that. That's after you met with the surgeon.
Yes.
So you met with the surgeon, I guess, was it a few days later on Wednesday, you said, right?
So diagnosed on Monday, met with the breast surgeon on Wednesday.
I'm going to ask you how that went, even though I know how it went.
Yeah.
How'd that go?
Yeah. So pre-COVID, right? I could bring my family with me.
Yeah.
Which, of all things that I'm grateful for, that it didn't happen to me during COVID.
Yeah.
Because I cannot imagine going through any of this and being alone in talking about these things. But there I was 7 months pregnant and change, sitting in a breast surgeon cancer clinic with my new husband and my mother who lives out of state. I'm like, what is happening?
Right. And you're just to set the stage, you're seeing someone who's at a major academic medical center who sees breast cancer all the time, sees pregnant women with breast cancer. This is not some sort of random clinic that's never seen this before. Right.
100%.
You're in the best of the best.
I will, the best of the best for sure. But I will probably maybe correct one thing that you said, not necessarily correct it, but modify it. I'm not sure that all breast surgeons are comfortable taking care of pregnant women with breast cancer.
I didn't say comfortable. Yeah. I said they've done it.
And I don't know. I don't know. I know it's not uncommon. Yeah. I know it's not uncommon, but I feel like it's not their bread and butter. It's not what they're dealing with all the time.
Well, most doctors have a phobia of pregnant women.
100%.
They are terrified of pregnant women, and they don't want anything to do with them because it's just
100%.
Yeah, but there is definitely experience there in pregnant women.
For sure. So. Yeah. Before I even met with the doctor, I had a mammogram done, which they reassured me would be fine while pregnant. So that was actually the first good bit of information that I got after I had them. They covered my stomach to make sure, to make sure that the baby would be fine with the radiation, that my cancer was only in one spot. I didn't have satellite lesions. I didn't have any other lesions in the other breast, any other lesions in the same breast. It was one spot, which for me, that was, I'm looking for, I'll take any silver lining I can get.
Under the circumstances, that's best case scenario.
Yeah.
Right.
So meaning it wasn't like, there are different types of lesions that are extending out. There was no chest wall involved, all the kind of stuff. Thank God. So met with the breast surgeon and she said, look, I'm just going to give it to you straight how this is going to be. You have cancer, but you'll most likely survive. Like you will most likely survive this, which I was like, that's like great news, right? And then right after she told me that, she said, but there's just something you need to know, that you'll never be able to carry another baby again. And I was just like tunnel vision. Like we all just sat there dumbfounded. And I was like, what? Like, what do you mean? Why?
Right.
You just told me I'm going to survive. I'm going to thrive. I'm going to do great.
Right.
Why shouldn't I be able to get on with my life after this?
Right. You're not taking out my uterus, are you?
Right. Yeah. She said, well, your cancer is hormone positive. My cancer was ER positive.
Right.
PR, which is estrogen and progesterone positive, HER2 negative for people that are interested, which means that my cancer, the gas that was fueling my cancer was the female hormones like estrogen and progesterone.
Which is probably why it popped up when you were pregnant.
Right. But it didn't appear, meaning
it grew because you were pregnant.
Because I was pregnant.
Right.
It wasn't created because of pregnancy.
Exactly. There's actually a lot of debate about whether, as a side note, whether pregnancy increases the risk of breast cancer overall.
I have a lot to say on that.
And most of the data is that it doesn't.
It does not.
It actually, in fact, it probably saves lives by showing the cancers that are otherwise sort of hanging out and hiding.
Yeah.
You get pregnant, they grow, but then you can take them out.
That's right. And then, I have a lot to say on that also, because I've learned a lot since this whole experience. I would say that we were floored.
Yeah.
And the doctor kept talking, but I was still on this.
Yeah.
I wasn't thinking about cancer anymore. The dreams of like the family that I wanted to have and the life I wanted to build, I felt like it was all gone, like in an instant.
And it's so interesting.
Not because of cancer.
Not because I may not survive cancer. It's because it's like, well, I'm going to survive, but now I can't have kids anymore.
Right. She was trying to talk to me and we're going to do this. And I'm like, can we go back to that? She's like, why do you want to keep talking about this? Like,
Why do
this
you
is what it is. This
Yeah.
is how it's going to be. If you can, maybe one day somebody else will be, hopefully you can freeze your embryos, maybe if we have time, and somebody else can carry a baby for you one day. Nothing against that. I don't have any feelings on surrogacy, not pro or against whatever. It's just not something that I ever thought about for me. And I was just floored. I couldn't wrap my brain around it.
Did you have a feeling at the time that may not be correct? Meaning that you're like, wait, were you skeptical or just shocked?
I think I was mostly shocked. And I would say that going back to what we were talking about, flipping the switch between being a provider and being a patient, my brain and my heart were fighting because I didn't know how much to challenge the doctor on it. Since then, I've learned a lot. And if you want an opinion about something, go to that specialist.
Right.
So a breast surgeon might not be the best person to talk to about risks related to fertility. There are other specialists for that, like oncologists and fertility specialists that can give you a better risk assessment about what those challenges might look like for you. But at the time, my life was over, not because of the cancer. I felt like all my, we'd mentioned that I have a medical background.
Right.
I've spent majority of my adult life not focusing on my personal life, focusing on school and training, self-advancement. And I had felt like now's my time. Right. Like, here I am, like, now's my time. I'm going to like pop out like 3 kids back to back. We had a plan and it was all gone. Like in an instant from like one sentence that somebody said. It was crushing. It was soul crushing. Yeah. Absolutely soul crushing.
It's so crazy also. I mean, listen, I think back, I know that between that day and the next couple of weeks, we spoke several times at length, right?
Yes.
About, because of this, you spoke with one of my colleagues. There's a lot to discuss, obviously, but I don't recall that was even part of our discussion. I don't remember, like when you told me that today, that you were told that you wouldn't be able to have kids, I don't recall that I ever knew that someone told you that.
No, I don't think you did.
Yeah, I mean, because we were talking about, okay, you have cancer, like what's the plan? Are we going to, she can do surgery first, this, and that was the big discussion and, talking about what to do with the pregnancy.
I don't know how much Julie remembers, Dr. Romero, which I don't know how much you want to build up to my delivery.
Okay.
Ultimately, when I came to deliver, which we can get to, the circumstances of that, I just was begging her to make it go my way. And I said, you know that this might be my last shot.
Right.
Like, I'm not going to get to do this again. Like, please don't make me have a C-section.
Right.
Like, please. And I was begging her like a not normal person.
Right.
Like,
right.
So we can get to that.
Right.
I think I felt like also I didn't want anybody else to tell me no at that point. Like, meaning that doctor had told me that, but I don't think I was at a stage to discuss it with so many providers to be like, yeah, that's true. Like, you're screwed. Like,
Yeah. So who you met with the breast surgeon, you met with us, you also met with an oncologist.
So I actually did not meet with an oncologist early on. I actually, after I met with the breast surgeon, your team actually, I don't think was involved in the conversation just yet. I actually went for a couple of other consultations to different academic facilities.
Right, that I remember,
definitely. To get different opinions. And what the doctor at my initial consultation had said was the baby needs to come out. We need to get your cancer out, but the baby needs to come out first. I said, but I don't understand. Like, I'm 7.5 months pregnant, but we have to get the cancer out. It didn't even occur to me at that time to say, like, why can't the two things go together? Why can't I stay pregnant and you take the cancer out? She was talking about, needing to be induced so that I could go on to have this lumpectomy. So a lumpectomy is where they take out, just a portion, whatever portion of the breast has the cancer plus the borders that are hopefully clear, not a mastectomy, which is the whole breast. Now I know a lumpectomy is like not a major surgery. Like, women that are pregnant even have appendectomies, which are much more invasive.
Right.
And so that's what prompted me to get a couple of other opinions. And in that time is when you and I and the team here really started putting our heads together to figure out what's going on and what we're going to do.
It's not something that any one specialist can come up with the plan, because it's something where what we do, the MFM doctors, we have to talk to the surgeon and we have to talk to maybe the oncologist. And again, it's sort of based on this cancer. Can you operate? How extensive is going to be? How long it's going to take? What's going to happen? What's the blood loss going to be? when do you have to do chemo? Which chemo do you have to give? How soon? What if it's delayed 2 weeks, 4 weeks, 6 weeks? And everyone's got to sort of figure it out and come up for the right plan for the right person. And also there's decisions to be made that are where there isn't a right or wrong answer. And it comes on to you, like which direction do you want to go? And that's hard, obviously, but it takes a lot of conversations, and it really has to be a team approach. And it's hard. This is hard stuff, obviously.
I would say that at that moment in time, I don't recall a sense of like, what do I want?
Right.
Which was a very difficult thing for me. Having type A personality,
Sure.
medical background of like always being in control. And, I would say that the provider, the breast surgeon, was reluctant to operate on me while pregnant.
Right. But we twisted her arm.
Yes, you did.
I remember speaking to her.
It was a very tumultuous
saying, no, you could do it. It's fine.
Yeah.
Don't worry. We'll monitor the baby.
That's right.
It's all good.
That's right. And when that plan was solidified, I took such a huge sigh of relief, because I'll never forget Dr. Fox saying to me, we don't need a sick mom and a sick baby.
Right.
And when you said that to me, something just clicked. And I was like, this is the plan. Because whatever is going to happen with me is going to happen with me. But for something so small like a lumpectomy, there's no reason why she can't get her shot, to go at least to somewhat full term and have less complications later. Usually
the surgeons, they don't even realize it's an option.
Yeah.
They're like, how, like, and we say, listen, you're not operating anywhere near baby. Like, so unless like there's the craziest complication in the history of lumpectomies, nothing's going to happen to anybody, and we'll monitor the baby just in case. And, if you induce the labor and deliver the baby, you're talking about a baby's going to NICU for a month and probably will be okay, but there's a lot of stuff. And then you have cancer and you're recovering from it. And now you have a baby in the NICU. And also from a mental health perspective, it's tough. I think the plan we ultimately had, which of course got blown up, but the plan is that we were going to do the surgery at like 32, 34
Correct.
weeks. And then after the surgery was done, we were going to deliver the baby so that you could get your eggs frozen so that you could then have chemo.
After the surgery, you were going to let me carry to 36.
36. Because you have to recover
weeks.
Anyways before you get the chemo.
Exactly.
Yeah.
And so at that time, actually, they didn't know if I was going to get chemo or not. That's the interesting thing. That was actually determined later by something called an oncotype test.
Right. And that plan would have allowed you to get the lumpectomy sooner and deliver a little bit later.
Correct.
And were you to need chemo, you would have had the time also to do some fertility, store some eggs.
Also not be pregnant when I got my chemo.
Correct.
Not that it's unsafe. I just want to say that
you can.
There are many women who get chemo while they're pregnant, especially in the second trimester, and the side effects are little to none.
It's okay in the third trimester too. People think it's much more dangerous to the baby than it actually is. The reason you don't normally do in the third trimester is by that point, usually you can just wait till after delivery.
Right.
But it is doable.
Yes.
Right. So, so that was the plan. And we were
plan.
ready.
And I felt like, man, I had this rock star team. I had like the best breast surgeon in Manhattan, and I had the best maternal fetal, the best high risk pregnancy doctors. And we just felt so relieved and confident. But, I had a lot going on internally and emotionally. And going back to my blood pressure, it was being affected by all of this stress. And I would say that to say that I was in my right mind at that time is probably an absolute lie. Sitting before you today is like a normal, composed person. Mm-hmm. But I would say that I definitely was going through an emotional breakdown for sure. Just the reality of it all, that I wasn't going to be able to have more kids or carry a child. I mean, I didn't think the cancer was going to kill me.
Right.
I just thought my life was over from my hopes and dreams for my family with my husband.
Right.
And I was a mess.
Right.
I was a mess.
As an outsider, you did look like a mess in terms of this, but sort of as expected.
Right.
I mean, none of us were saying, oh my God, she's losing it. No, it was like, we're like, this is really hard.
Right.
She's trying to juggle all these things and deal with all these things.
I definitely think I did the best I could.
No,
honestly,
you did great. You
with
did
what I had.
You did as well as anyone could do under those circumstances.
But I was not in my. I can tell
trying.
you 100% looking back now. 100%, I can tell you that I was in a completely like dissociative state, to the point where, and this is where the plan got blown up. Yeah, is that I basically came into the clinic for my pre-op appointment for this lumpectomy while pregnant, that everybody's, the Gold Star team is on board to help me. And my blood pressure was like, whew, and
New
they
plan.
said- yeah. And they said, all right, well, you have to go to the hospital now. Looking back now, in the time between that the plan was put in place and the time that I came in, I was not well, meaning like I wasn't feeling well. I could say looking back that I definitely was ignoring signs of being sick, for sure. But my mind was so wholly focused on getting to the lumpectomy and carrying my baby to full term.
Right.
To the point where that sounds crazy. Like I'm a physician. How can you say, how are you ignoring signs that you are like medically ill? To the diagnosis of preeclampsia, which is, there's no logical sense behind it because preeclampsia can be life-threatening for the mother and for the baby.
Right.
So there's no logic behind it. But all I can say is that I was in a fight or flight mode for sure, evident by my blood pressure. I just felt completely defeated when I was admitted to the hospital to have the baby.
Right. So that was the plan. We said, this is A, it's not safe to have surgery when you're like this.
Right.
B, it's not safe for you in general. C, it's not safe for the baby. So when it's that bad at 34 places, we would have done that anyways.
Yeah.
Cancer, no cancer. Right. At that point, we're like, all right, it's time to deliver. It's safer for you, safer for the baby. I said, okay, you'll deliver. And then you'll have the lumpectomy.
Right.
Like we'll sort of just change the
Right.
order of things. Did you sort of feel like, well, at least this was taken out of my hands in a sense that I didn't choose when to deliver the baby, when to do this. This is just sort of dictated. Or did you feel like no control was taken away from me?
It's a very complicated question. And I'll say that
this is a tough podcast. Yeah, we really get into it.
Some of what you said right now, I did feel, but not in relation to the delivery. So for example, ultimately when I needed chemo in between the time that I had the baby and then I had the lumpectomy, they take out the tissue, they send it for a special test called Oncotype, which basically determines whether you're going to have chemo. If the number is low, you don't need chemo. If it's high, you for sure need chemo. If it's moderate in the middle, it's like a discussion between your doctor and you decide. And I was so anxious that I didn't want chemo. I was so anxious. And then when I got the result that my score was high and I needed chemo, the wave of relief that I felt, because I felt like, number one, the decision was taken from me. Like, This is the number in black and white. Like, You need chemo. Number two, I felt like, let's just throw everything at it. Like, we are just going to throw everything at it. Like, chemo, whatever, we're going to do it. So in that regard. But as far as the delivery goes, I would say probably not. I didn't feel that way at the time. Looking back, I think everybody helped me to the greatest extent that they could. I was admitted and nobody told me you are 100% needing a C-section. No, not one of the doctors said that to me, which I was so appreciative of, because the only thing I could think is, this is my only chance.
Right.
This is it for me. Like, however this goes right now, however you feel, like if you have a once in a lifetime chance to experience something, you might want to grab onto it and take it, right? So, it was very emotional, but I would say that they gave me the steroids to help the baby's lungs develop. So I was given like a 48-hour kind of chill out period with the wonderful magnesium on board. So the magnesium is an IV medication they give to bring down your blood pressure.
And if you weren't loopy enough, that really...
I was like drunk and high at the same time.
My
mother was like, has she had a stroke? Like, like that. 2 days of just chilling out. And then I was very appreciative. The team gave me a chance to try and have a natural delivery to get induced. And I felt like it was the best case scenario that at least I could try to have somewhat, people talk about these birth plans that they have. I never really had a birth plan, but I didn't think you would ever go this way.
Right.
This is like the worst outcome possible.
Right. Very few people have in their birth plan, all right, then I'll have the lumpectomy.
Right, exactly.
Then,
But ultimately, after I got the steroids for 2 days, they decided, we'll give you a chance to have the baby naturally. And they tried to induce me. But unfortunately, after like 24 hours, I wasn't progressing. The wonderful Dr. Romero came to tell me that, this is not like going the way we want, and we're going to have to go to C-section.
Bad news, Julie.
Right. And, I'll never forget, like, I honestly, like, I feel sorry for what I did to Julie because I literally just sat there and cried. I just cried and I begged her. I said, please, please, please don't. Just like, give me another hour. Give me another 2 hours. Like, what could she say? What could she do? Like, it just is, I'm not trying to get emotional here. But I was just begging her, begging. Please don't take me. Don't, The whisperer had to come in. Dr. Fox had to come and walk me off the ledge to tell me, like, it's okay. Like, we did the best we could. This is how it's going to be. So ultimately I had a C-section.
Was I that matter of fact and cold about it?
No, you were great.
This is how it's going to be.
No, but in a very loving and caring way. And to be honest with you, in this whole process, I think I became very jaded as far as providers go, just from some of, words matter. Words are very powerful, especially when you're in a very vulnerable situation. And it's very important to find doctors that you can connect to. And so
choose your words wisely.
Choose your words wisely.
Yeah.
So no, you were very, very kind.
Oh, thank you.
You were able to convince me to go to C-section. You can't take somebody kicking and screaming,
right,
who's out of their mind to C-section.
Right. It's certainly not ideal and potentially illegal.
Right. So, ultimately I reneged. I agreed.
Yeah, but it was the right thing. I mean,
100%.
Ultimately, what are you going to do?
100% it was the right thing.
Yeah.
I mean, my daughter, who was estimated weight to be 5 pounds, 4 ounces, came out 3 pounds, 14 ounces.
Yeah. That was one, not a good
she
placenta.
Was tiny. No. And I just remember I was so drugged and I looked, the resident brought the baby over me and she's like, here's your daughter. And I was so drugged.
Right.
And I just looked up at her and, I'm going into my training and I said to my husband, I said, she's so small.
Mm-hmm.
She's too small. She's too small. So, that was scary. But you know what? She was breathing on her own, doing everything on her own. She was just a tiny little thing. Ultimately, she did great. She did great in the NICU.
Yeah. How long was she in the NICU?
Less than 10 days for sure.
That's a short amount of time.
Yeah, she was just there
weeks.
for feeding and growing.
Yeah.
That's it. She literally, thank God, didn't have any other complications.
Yeah, they're like the superstars of the NICU.
If there's one place that's going to reel you back into reality, if you think your stuff is bad,
right,
go to the NICU.
Yeah.
Pre-COVID, you meet other people at the NICU, other families. And by that point, both of my parents were already with me. And so we were all, sitting in the waiting room together. There's another family who has a baby who's been waiting for a heart transplant for how long?
Yeah.
It's just that old story. If you could throw your problems, in a bucket,
Right.
Heartbreaking. So NICU, a lot of good lessons there. But my daughter did great.
Yeah, and they're amazing. They're
amazing.
just unbelievable.
I mean, it's unbelievable. It's unbelievable. So my daughter did great. For me, I would say that my preeclampsia sort of extended to postpartum. There was some problems there with my blood pressure. So I had an extended stay at the hospital. I've had a journey since then.
When did the lumpectomy get done ultimately?
So the lumpectomy was 10 days after my C-section.
Right.
So in those 10 days, I had physical difficulties, but also emotional difficulties.
Yeah.
Recovering from the C-section was not easy. My breast surgeon had told me to suppress the milk from the affected breast.
Mm-hmm.
So because the less milk that was in the breast for the lumpectomy, the cleaner, surgery would be, and the milk makes everything, hard to do during surgery. So
they're so finicky, those surgeons.
Yeah. But, of course I'm trying, I want it to be, perfect for the surgeon. I don't, want to muddle things. But at the same time, I had this tiny baby. She wasn't even 4 pounds. I tried to breastfeed her from my good breast in the NICU and she didn't latch. And I just took her off and I just said, I couldn't do it. I felt like there were a lot of things going on. Ultimately, I felt like I felt very much like a failure just in general, just because I knew that of everything I was going to go to. Why do I want to breastfeed her now when I know in 10 days I'm not going to be able to? Why do I want to give her that only to take it away? So what I did was I pumped from my good breast as much as I could to give her the colostrum and whatever. I wasn't making a lot. I think that's probably down to the stress and all of that. But I did the best I could. And I feel happy about those decisions that I made at that time, even though my surgeon wasn't happy, because sort of you're stimulating one breast, the other breast contralaterally might get messages. So it wasn't suppressing as well. But I felt ultimately like I did what I could to help my daughter be strong and grow. Yeah, so 10 days later, I had the lumpectomy. During the lumpectomy, they also do what's called a sentinel lymph node biopsy,
right,
where they check the first however many lymph nodes are in the chain under your armpit. And my lymph nodes were negative. Thank God. I was very, very lucky.
After that was done, and you said you ultimately did need chemo, and you had made a decision before the chemo to have eggs retrieved, as if you're undergoing IVF right away. And that was pretty soon after you delivered. I mean,
very soon. It was
more
actually,
soon than typical, obviously.
It was very difficult. So, luckily I was recommended to go to a very, very good fertility specialist here in the city. When you have, it's called definitive surgery. So my lumpectomy was my curative surgery. You have to, if you need chemo, you have their guidelines. Like it has to be within a certain amount of weeks in order to be optimal.
Yeah.
So, my body, I still had like a gravid uterus, like everything
Yeah.
needed to kind of settle down before I could start medications that were going to stimulate my ovaries. So, that was difficult. Some women are able to do more than one round before their chemo and some women not. For me, I was only able to do one round, and I would say it was moderately successful. I would say I think definitely it was not optimal because I was so close to being postpartum, but I was able to freeze a couple of embryos. So that was really, really fortunate.
Right. It's great. And it's great that they're willing to do it, to work with you.
For sure.
For that timing.
I think that in the cancer realm, especially breast cancer, which unfortunately affects a lot of young women, I feel like it's like a totally different ball game. Like if you look back even 10 years ago to now, the things that are advocated for.
Yeah.
And fertility preservation is just one of those things
Absolutely.
that is so great that it's really stressed and they really try to do it as much as possible. I was able to freeze some embryos. And then as soon as that was over, like I had mentioned before, I got the results that I needed chemo. And then I did chemo.
How long were you doing the chemo?
It was 3 months,
3
4
months.
cycles.
Okay.
Yeah, my daughter was very small at the time. She wasn't even 3 months old. I would say she was a healthy baby, but she was preemie.
Sure.
She was very small. I needed help. I needed a lot of help taking care of her. And I was just very lucky and grateful that my parents were able to literally stop their lives to help me. Somebody had to work. So
Right.
my husband had to work. Yeah, it was not easy. It was, chemo was a very, very trying time from the standpoint of being a mother, trying my best to take care of my daughter. It was very hard.
Yeah. I mean, listen, it's your first baby. All right. You had a difficult pregnancy. You had a not a difficult delivery per se, but not sort of what you were expecting. And you had an operation. You had another operation. You have a cancer diagnosis. You're getting chemo. I mean, like this is a real rough time.
Yeah.
Emotionally, physically, mentally. I mean, with the
chemo, you have good days and you have bad days. And on the bad days, I just needed to be alone.
Yeah.
And there were just days where I would just hand my daughter off to my mother or my father. And I would say, I can't do it right now. There were days where I would just hold her and cry because I didn't see the end for me. And I also felt like this is not what I wanted for my daughter. Like, this
Right.
is not the kind of mother. She's like, I'll never forget. I woke up one night in the middle of chemo and I woke my husband up and I said, I need to talk to you. He's like, okay. So we get up. We sit up.
It's never a good start.
Never a good start. And I said, I've been really thinking a lot, very hard about this. He goes, okay. And I said, I think we need to put our daughter up for adoption. And he's like, what the hell are you talking about? And I'm like, no, really. And I mean, if I tell you, Dr. Fox, not in my right mind.
Yeah.
I said, she doesn't deserve a mother like this. She's, this is going to scar her for life. I can't hold her. There are days I don't want to be with her or be around anybody. What am I going to be like after all of this? Am I ever going to be normal? Am I going to be able to give her what she wants? Like, this is not fair to her to like be in a home with somebody who's so sick. It's not fair. I want to give her a great life. My husband's like, go back to bed. Go back to bed. Like, you're talking total, complete nonsense right now. It just touches on the point of like total desperation and feeling of inadequacy, which ultimately my husband told me, he's like, this is just like a blip in the radar, like of her life.
Oh, no,
and she's not going to remember 1 second of it. And if anything, when she's older and I tell her the story, she'll really, admire me and,
Hopefully. Yeah.
Yeah.
If she's a teenager, maybe she'll talk to
right.
you.
Yeah,
She'll acknowledge
exactly.
you. Were you having any professional mental health care during the time?
I mean, it was offered to me.
Yeah, no, I'm just saying, so you weren't. It was
No,
okay.
I was not.
Yeah. And
no.
again, that doesn't, and if you were, it doesn't mean that wouldn't have happened anyways.
Also, I also want to touch on this is that I definitely don't think I didn't have postpartum depression. Like, I didn't have the blues, like, meaning it was all situational.
Sure.
Like, I felt like my anxiety or depression was completely situational because of what was going on.
Yeah.
And as soon as I was able to really grapple with it, I clawed my way out of it. And I couldn't have done it without my family and some very good friends. But ultimately, it was really my husband saying, no, like, you are going to do this. Like, you will bathe her. You will feed her. Like, you will do all of these things and you can do it. Like, you feel fine.
He doesn't come out sounding too good on that statement.
No. I mean,
you will feed her.
No, I know.
You will bathe her.
meaning,
you
like,
can do it.
You can do it.
Yeah,
you can do it. Meaning, and
my
husband,
like,
my husband's literally a saint. Anybody who knows him.
Whoa, I just got thrown under the bus here.
He's the most hands-on father.
He's like, I'm not Ike Turner.
No. He's literally the most hands-on father. He's amazing.
Yeah.
Totally, I won the lottery. But
yeah, and so about when you're saying how you would give the baby to your parents for the day, or listen, you're a parent, I'm a parent. I can tell you right now that your parents are so thankful they were able to do that, because they're seeing their baby girl suffer, right, and she's in misery, and they're like, at least I can do this, right?
100%.
There's one thing I could sit in her living room and look at her all day, but 100%. Here I can do something to help her heal. Essentially, you gave them an opportunity to help, which is so important for them.
Yeah, 100%. It was needed all around.
Yeah,
and I would say that the turning point for me was really just like on those good days, meaning so my parents would come during chemo days. Like when you have chemo, you have like the bad days or a couple of days after, and then you start coming out of it and you start feeling fine, where it was just me. It was just me and my daughter, meaning they would go, my husband would go to work, and I'd be home with her. In the beginning, I felt like, well, what kind of mom am I? I'm just sitting here. I don't take her out in her stroller. I don't have the energy to push the stroller. So I just sit here all day. And at first I felt like I'm not giving her enough. And then I thought, you know what? Like, this is everything. As long as we're together. Those days that we were alone, where I was just taking care of her, even if I had no hair and I had no eyebrows and, I wasn't feeling great.
Right. Neither did she.
Yeah, neither did she. And we were doing it just her and I, all alone.
It's amazing.
And we did it, and we did great. So, we grew our hair out together. It was funny. I always joked we had a competition who's going to grow their hair first.
These are the things you look back on, obviously. And, there's all the trauma you look back on, but then there's this sort of like sweet moments at the same time. Yeah. You're 3 years out now. Just most importantly, how you doing?
I'm doing great. Good days and bad days. I think something very important to realize about breast cancer is that a lot of people think when the surgery or the chemo is over, it's over. And it's not. For me, because I had hormone-positive breast cancer, the treatment that I am to receive, either for 5 or 10 years, has some very serious side effects, which affects everybody differently. For me, the side effects were basically pretty crippling for me. Joint pain and joint stiffness from the hormone suppression. So, meaning some women can take only tamoxifen alone.
Right.
Other people get ovarian suppression plus tamoxifen, or ovarian suppression plus an aromatase inhibitor. And all of those elements that suppress your estrogen basically cause, besides the menopausal symptoms of like hot flashes and whatever, one of the side effects that are the most debilitating is joint pain. And so that was sort of the other issue that came up for me once my chemo and all of that was over, was starting that treatment, because I felt like, here I am, like now I'm finally able to be this person, this active mom, and do all these things for my daughter, to the point where I was so arthritic that I couldn't even close her snaps, like on her onesies. I couldn't button a button. I couldn't tie a shoe. I couldn't turn a doorknob. It was painful just to hold the stroller bar. So those are all difficult things. The oncologist will work with you to try different modalities to try and help with that. But ultimately, it's very debilitating. And, other side effects, which whatever, I won't go into now. But overall, where I'm at right now, I'm actually taking a break from my treatment to try to have another baby. And so I can fully say that the doctor did not know what she was talking about when she told me that it will never happen for me. Because since then, I have read, researched, talked, learned, and all of the most recent evidence, which if you're a doctor or a scientist, we believe in evidence, we believe in science and facts, show me the data, right?
Hashtag science.
Right, exactly. Hashtag science shows that, for women with early stage breast cancer who are in their reproductive years, that after a certain amount of months on hormone suppression, it's safe to have a baby, and that it won't increase your chance of recurrence. It may even decrease it.
Right.
There's actually a big trial going on right now called the POSITIVE trial, which is an acronym, which I don't know right now.
It's always an acronym.
Yeah. But basically, it's pregnancy outcomes and safety after breast cancer. And so I actually wanted to be in the trial. It was really important for me. I made it like my plan. That's actually really what got me through a lot of my treatment was that ultimately I was going to be able to, I was taking off the months of hormone suppression,
Right.
the suffering and the pain, that I'm going to be able to come off my medication and try to have a baby, one more month, It hasn't all been smooth sailing, but just getting here has been amazing. I actually was about to be enrolled in the trial, but the trial became full right before I could be in it. But I actually, in this world, there are amazing people. And I actually, the head of the US arm for the trial, she's out of Harvard. And I just sent her an email one day and I was like, what do you think? Like, should I do this? Here's my information. She wrote me back a whole long email.
So nice.
You're a great candidate. You should do it. And, my oncologist is really supportive, even though I'm not in the trial.
Right.
So it's very important to have people on your team that listen to all your goals, not just staying alive. But I would say that, in life, like I would say, if somebody tells you need chemo and you get 3 opinions and they all say you need chemo, like you should probably get chemo, right?
Right.
But when it's a little bit not as black and white, a little bit more gray, it's so important to read and advocate for yourself, learn, talk to other people, because it's not all cut and dry. There are so many women out there that I've personally met and spoken to that have gone on and had children after breast cancer. I'm not saying it's for everybody, and I'm not saying that everybody can do it. It's, don't want to give false hope to anybody, and it's not for everybody. Not everybody's comfortable. There's a risk involved in everything that you do. But, I would say if it's something that's important to you, like I would never want to say to somebody, your dreams are not valuable. Some people would say to me when I was, going through it, they'd say, well, you know what? Thank God you have one child. Like, you're good. Like, at least you have one. I know you're not going to be able to have more, but at least you have one.
Right.
And I'm like, but that's not my dream. Like, maybe to you that would be okay, but just because you feel that that's okay doesn't mean that I feel that's okay.
The same person would probably not say that if you had a child and then lost a child. They
Right.
would say, well, you have one left.
Right.
Right. But that's how
Exactly.
you view it. It's like
Exactly.
a loss. You're losing the family you thought you were you're going to have. I wanted to ask you a few things that I just thought were so interesting to get your perspective on from the pregnancy and now looking back. At the time you were diagnosed, was there any moment in time where you felt it's me versus the baby? Like, or, like if we do what's right for me, it's bad for the baby. Or if we do what's right for the baby, it's bad for me. Like, were you made to feel that way, or did you feel that yourself?
I think that I did have somewhat those kind of feelings, but I think that it was more of, obviously I wasn't in my right state of mind, but of self-sacrifice, meaning towards the end when I knew I wasn't well, and I probably should say to somebody like, hey, like my vision's blurry, or like, say something in my twisted mind at the time, because I was so focused on getting my daughter to a healthy place that I felt like I'm going to sacrifice myself so that my daughter can get to the end, where in reality, that's not the case, because we would have both been up, what's creek without a paddle. I did feel that I would like give it all to me, like give me all the pain, the suffering, just don't put her in the NICU.
Right.
I don't want to see her on a ventilator. I don't want to see her with complications from that.
A lot of women do feel that way in pregnancy, but it usually doesn't work out that way. Like I said, usually if it's not good for the mother, it's also not good for the baby. And there's so many layers to that. There's also, there's sort of like what you could see on the surface, but then there's the next layer of, again, there's your physical health, there's your mental health, and with the baby, there's all these other variables. But it's one of the times when that conflict potentially comes to the surface for people, and it's very hard for them to process that.
Yeah,
100%.
Like,
they're like, well, then becomes like guilt versus, again, competency, like all these things. As a mother, it's just it's pretty gruesome. I mean, obviously, don't explain why it's so hard to get, why it's gruesome to get a cancer diagnosis during pregnancy, but that is one of the facets. And the other thing is, in terms of processing emotions, you're at the end of pregnancy, which is a joyous time.
Right.
And you're also in a very fearful time. How do those two emotions work together? You deliver a baby.
They didn't. For me, they didn't. For me, they did not work together.
Did the fear override the joy?
100%.
So you couldn't really feel the joy.
It wasn't actually fear. It was absolute heart-wrenching sadness.
Okay.
It was just sadness.
When was the first time you felt joy about having your daughter, would you say? Like true, like, I'm really happy to have her,
I think when we took her home from the NICU, and like I finally got that you're part of your birth plan. Like I had her little outfit, which of course didn't fit her because
Right.
she was tiny.
Right.
It had strawberries on it and it was just very sweet. And when we put her in and she was like literally like swallowed by the car seat. She was so small, but I think my husband and I just laughed. We had a really good laugh when we looked at her and we're like so proud to take her home. And we felt very proud that we got her, to this place. She's coming home. She's, thank God, healthy. She doesn't need anything else besides high calorie formula. And, I think I really felt a big sense of pride there.
That's
that
good.
I did it.
Right.
Even though I made a lot of mistakes along the way. Cancer aside.
Yeah.
But, personal mistakes because of my emotional fragility. But we did it. So we made it.
We spoke a lot about your various, your doctors and how from your original doctors to the one who, helped you when you were getting the biopsy and the results and everyone else. There's this idea in medicine, you know about this, I know about this, about patient autonomy, about letting people make choices for themselves, which is a great concept, but doesn't always work out perfectly for many reasons, versus sort of like, just tell me what I need to do. And what was the balance you were looking for at the time? And where did it work or did it not work?
I would say that I've definitely learned a lot and I've grown a lot. I've learned a lot about what it means to advocate for yourself.
Mm-hmm.
And it's definitely not a simple thing like, hey, Dr. Fox, I want this. That's just the tip of the iceberg of self-advocacy. Self-advocacy is also reading, talking to people, getting other opinions, not necessarily feeling like there's only one way. And I think that's also a mindset. It's not necessarily only the give and take between the doctor. It's also the patient's mindset of being able to look outside and sort of say, is there another way? So a good example for me in that respect, I would say, is after my chemo, I had an option of I could get radiation or I could do a mastectomy. For me, my genetics panel was all negative, meaning I don't have either BRCA.
Mm-hmm.
I don't have any, back in the day, they only used to do BRCA 1 and 2.
You have none of the cancer genes.
Yeah,
right.
Today they have all these other panels. So who the hell knows
right.
why I got this? I don't know, whatever. Right. But I was negative for everything, thank goodness. So on paper, I didn't need a double mastectomy.
Mm-hmm.
On paper, I didn't need that. There's a big push in the last couple of years in the world of breast cancer that if you can do a lumpectomy, which is basically breast sparing, meaning the woman still isn't as disfigured. She just has a lumpectomy. She has the piece of the cancer removed. She's not as disfigured. There's a big push for that. A lot of data came out that there's no difference in the outcomes between mastectomy and lumpectomy. That's great. I'm all about #science.
Right.
So when it came time for me to make the decision of what I was going to do, I knew that I didn't need a double mastectomy. We're not in the days of Angelina Jolie. We're like, oh, you get a double mastectomy and you get a double mastectomy. I knew that I didn't need it. But something interesting that was posed to me was that if I did a mastectomy, I wouldn't need radiation. So meaning because I didn't have lymph nodes involved, I had a lumpectomy on the area, you need some type of cleanup.
Right.
Cleanup around the area could be radiation locally to the breast tissue, or it's a mastectomy. For me, because I didn't have lymph nodes involved, if I got a mastectomy, I didn't need radiation. And this is where I think, for me, this is where a lot of my self-advocacy came about. I really deliberated a long time. I spoke to a lot of people and read. I was 33 years old when I was diagnosed. My tumor was on the left side. The radiation that they do today is very focused. The likelihood of having any, lung injury or cardiac injury is low. It's not zero. But for me, because of my age, I was worried about long-term effects. The long-term effects of radiation come out later, like heart failure and those kinds of things, meaning 20 years later down the line. So for me, combined with the fact that I have very dense breast tissue and my breasts were very large, I felt for me that I wanted to have a mastectomy.
The fact that you were planning at more kids, was that part of that decision also?
You know what? I felt like my daughter at that point was formula fed and doing great. And I felt like, I knew in my heart that if I did only the lumpectomy with radiation, I would constantly being biopsied, constantly being scanned because my breasts were dense and very large.
And again, you're 33.
Yeah.
It's going to be the next 60,
and I
70
thought,
years.
You know what, if it's breastfeeding, which obviously it's sad that if I wouldn't be able to do it in the future, but I felt like if that's the thing I have to sacrifice, for me, it was worth it. It's not necessarily peace of mind because as the data says, it doesn't really change your recurrence rate or overall survival.
No, it was just the right decision for you.
It was the right decision for me. And so ultimately, because of the mastectomy and issues with symmetry, I actually was approved to get a double, and I was very happy about it.
You mean approved by like insurance?
Yes.
Yeah.
So the doctors were very discouraging. The breast surgeon did not want me to do a mastectomy because nobody wants to be that doctor today that does a mastectomy when you don't need to.
Right.
Because it's not.
Right.
Today it's considered not. I don't want to say the word overkill, but meaning that's the trend right now is to be more breast aware and breast sparing.
Right. They don't want to be referred to as like the barbaric surgeon who's disfiguring women, even if it's what you wanted.
Right. That's right. So that was a juncture where I could make a choice.
Right.
So I had already made my choice. And then I basically had to think about reconstruction of what kind of reconstruction did I want? And this is not a knock on anybody who has breast implants at all. But I think it's very important to understand that women who have breast implants after a mastectomy, it's totally different, both from how they look and also how they feel to, let's say, a woman who had smaller breasts who wanted an augmentation.
Right.
The look and feel is totally different because you don't have that breast tissue there. And I was just reading about, women that have had breast implants after mastectomy for long periods of time, the issues that they've had. I'm sure you've heard of it, like breast implant illness,
right?
All kinds of problems that you can get with them, reactions, allergic reactions. And then ultimately you have to change the breast implants out around every 10 years. And so because of my age and all of those factors, and I know I'm already an allergic person based on the story, I said, you know what, it's not for me. Like it's very well for somebody else, could be for somebody else, but for me, it's not for me. I'm not going to get breast implants. Like I'm not going to, breast implant illness, if you've heard of it. It's something that's there's also other cancers you can get from the implants, like certain types of lymphomas. I was like, I'm not going through all of this to get some other problem from a foreign body that I'm going to elect to put in my body right now. Like there's just not, I'd rather go flat. And so ultimately I learned about natural tissue reconstruction, which previously in the past, I would say 10 to 15 years, was reserved for women who had extensive radiation on their breast, who the skin couldn't tolerate an implant, meaning the skin wasn't stretchy or pliable enough. And their only option was to get a natural tissue reconstruction. But as the data has evolved and new information has come out about, women after mastectomy having problems with breast implants, more women are electing to do natural tissue reconstruction. Ultimately, that's what I chose. Right. It's not like a simple procedure at all.
It's not a walk in the park.
It's not liposuction. It's not like a Brazilian butt augmentation.
Right.
It's not it's not just liposuction. It's actually, you have to go to a specialist called a microsurgeon who basically resects a part of your body. For me, it was my abdomen, my stomach. They resect the arteries and they connect them to the arteries in your chest because the tissue can't survive without perfusion. And if you don't go to a good enough specialist, or sometimes it's just bad luck, the transplant can fail. You can end up with one and then you have to try again with another source. So my doctor, I think, thought I was like a nut, that I was going to do this surgery when I didn't necessarily have a clear need, like meaning I didn't try a breast implant and fail. But ultimately I knew in my heart it was the right decision for me. It was a very long surgery. It was 12 hours. I really had to advocate to get to the plastic surgeon that I wanted, who was absolutely phenomenal and amazing, who changed my life, like a mensch, bar none. Yeah. It was the best decision for me. Like I would advocate for that surgery for anybody who's even might be in this situation or thinking about it. There's nothing like the feeling of having your own tissue.
This mindset, has that changed how you think as a doctor or how your husband thinks as a doctor?
100%. Just going back to the words, like just words are so powerful, much more sensitive to things of this nature. I know he gets particularly affected when he treats women who are breast cancer patients. Just a lot of sensitivity there.
Right. What about in terms of like autonomy and giving patients choices? And do you think differently about that as a doctor?
Not to say that I'm like the greatest doctor ever, but
you are.
I would say that pre my diagnosis, I always said, I learned from one of my mentors, like every doctor knows their limitation. Like every doctor also needs to know when to say, let's get another opinion.
Right.
And the doctor whose ego is so big that they can't stop and do that probably is not the right doctor for you.
Yeah. I believe that so strongly.
Yeah. And I would say that I've never had a problem saying, like, pump the brakes, like, let me get somebody else involved and to help us out here. But I would say even more so now, I really try to ask the questions to the specialist who it's directed at. because people generally have a lot of opinions and feelings and things they've seen. But I try to really direct my questions to the appropriate specialist.
Right.
Yeah.
I asked you how you're doing overall, but I'm curious in terms of one specific thing. Your birth, obviously, thank God your daughter's healthy and you're doing well, but obviously very traumatic experience to go through. And this is something that's come up before on the podcast, that even when the outcome is good, the event is traumatic. And that itself is something from which you need to recover, so to speak. Where are you in that in terms of like the trauma and thinking back on it? How are you now compared to then? What do you think it's going to be moving forward? I'm just really curious to hear your thoughts on that.
Because my journey was really situational, meaning around my trauma, I should say, was based on somebody else, me hearing somebody else dictate my reproductive future. I think for me, when I have another child, I think it'll be very restorative for me. And I know that seems like very like cut and dry, like I'm not healed until I have another child. That's not the case. The fact that I'm already here on this journey and have 7 specialists behind me that are rooting for me, I already feel that I've crossed the finish line. But ultimately, I feel like what I really would like to do is, God willing, have another baby and walk into the surgeon's office and be like, hi, remember me?
Yeah.
No, just kidding.
Was there a point where where you couldn't even tell the story because it was just too painful? Yeah, I would imagine it takes a long time to even talk about it.
I mean, there's a lot of shame also. I mean, I think depending on where you come from, what, also community, whatever your background is, your involvement, I think there are stigmas and taboos around talking about these things. And I would say initially I was much more reserved, but I'm definitely not as so, meaning I am involved in groups. I talk to other women. I've made myself available to be like, meaning through my doctors, they know that they can have their patients reach out to me if they want to talk about anything or have any questions. It was actually a big part of how I got here, because through my plastic surgeon, I met a woman that was on the patient referral list who told me that she's had 3 children after her breast cancer. And she was like, just stick to the plan, like stay positive. This is just temporary and you're going to get through it and you'll have everything you want.
Last thing I want to ask you today, we're going to talk many more times moving forward, but today, looking back on this whole thing, global view, where you are now going all the way back then, what have you learned about yourself? And what have you learned just about life in general? Like the big lessons that you know now that you didn't know then?
I would say pre-cancer, anybody who knew me always knew that I was like the get it done person. Meaning like if there was an issue that came up, if there was anybody that could do it, they could call me and I could solve the problem. I could make whatever it was happen. That's an element of being like very type A, very aggressive, very organized to like a fault, overly so, and also overly controlling. I don't want to say not controlling my relationship, but controlled every aspect like of life to the most minute detail. And I think going through all of this, I've really had to like let go a lot. It also comes back to also like being the provider and the patient. I've had to learn how to be the patient. And I think I've really come a long way with that, where I can just sit in the doctor's office and just be the patient.
We'll find out.
Yeah, you'll find out.
We'll see.
I've sworn up and down to every doctor. I'm like, I am a changed lady. I will be the best patient you ever had.
You were a great patient. You're giving yourself a lot of, bad rap here. You were a great patient going through something really horrible. You were always kind. You were always thoughtful. You were always asking the right questions. You were ideal. You were just going through a horrible thing, right?
Yeah.
So yeah, you're an emotional wreck, but you should be an emotional wreck. It's an emotional wreckage that was happening. But no, you were a great patient then.
Thank you.
Yeah.
No, but I just definitely think letting go of some of the aspects of control and letting somebody else take care of you, trusting in that, having the ability to let go and say, you decide. That's that balance between autonomy and not, because at some point you're tired.
Yeah.
At some point you just want to say, just like, take it from me and just tell me what's the right thing to do. Because your brain just gets so tired from constantly having to be 3 steps ahead when you're fried, you had chemo, you had this, you had that, and your brain's always, what's the next move? What's the next move? But you're tired,
Right.
So
Wow.
I've learned a lot.
Listen, well, I'm inspired by you. I think that you're amazing. I think that what you went through was so huge and so difficult, but you handled it honestly. Yes, it was very difficult at the time, but it's been a while. We've known each other a while with such grace, actually, and the fact that you're willing to talk about it for a very long time, and which is great. I think that it is just on the face of it, just interesting and fascinating. People will hear it and say, "Wow, like that's I'm a better person for hearing this story." But there's women out there who are going to hear this, and it's going to resonate with them personally. Obviously, if it's exactly the same thing or just close enough and the same emotions. And it's important, like you said, to tell your story. It's for you and it's for me and it's for people who listen. And it's just really profound. And I just appreciate you doing it.
Thank you.
I'm so glad I got to talk to Jamie about her birth story. When she came in to record a few weeks ago and I got to see her in person again, it brought me so much joy. She looks terrific. She has a huge smile on her face. And thank God she is doing great. Thank you for listening to the Healthful Woman podcast. To learn more about our podcast, please visit our website at www.healthfulwoman.com. That's HEALTHFULWOMAN.com. If you have any questions about this podcast or any other topic you would like us to address, please feel free to email us at hw@healthfulwoman.com. Have a great day. The information discussed in Healthful Woman is intended for educational uses only and does not replace medical care from your physician. Healthful Woman is meant to expand your knowledge of women's health and does not replace ongoing care from your regular physician or gynecologist. We encourage you to speak with your doctor about specific diagnoses and treatment options for an effective treatment plan. Paid sponsors of the podcast are not involved in the creation of the podcast or any of the content. Support for our sponsors should not be interpreted as medical advice from the podcast, the host, or the guests.